Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain pituitary mass. Endocrinology is a study involving hormones of the human body, and the pituitary gland is a special stimulator of many glands, and it releases many hormones by itself. Problems in this region of the brain, especially the mass compressing the pituitary gland, can present an array of problems, by which the eyes can be affected as well. Pituitary mass is an abnormal growth of cells in the pituitary gland. This is of particular importance and deserves special attention because the pituitary gland is responsible for controlling downstream release of hormones throughout the glands in the body. Therefore, a mass in the pituitary can cause a cascade of various clinical symptoms and signs depending on the alterations of the hormones that this gland controls. Let's go over the anatomy of the optic nerve. The ganglion cells across the retinal layer stretch their axons to the blind spot or the optic disc. From there, it exits the eye and stretches back to the brain. Along its path to the occipital lobe, the nasal portion of the optic nerves, those that innervate the nasal retina, cross over at the optic chiasm. This is very close to the region of the pituitary gland. A NOSP classification is used for classifying pituitary mass in terms of location. 3 lines are drawn between the supraclinoid internal carotid artery and intracavernous internal carotid artery on coronal MRI imaging. And these 3 lines are medial tangent, intercarotid line, and lateral tangent. So these 3 lines are used to define the 4 grades of cavernous sinus invasion of the tumor. So grade 0 is if the tumor is located between the medial to medial tangent line. Grade 1 if it's between the medial tangent to the intercarotid. 2 if it's between the intercarotid to the lateral tangent. 3 if the tumor extends lateral to the lateral tangent. 3A would be above the intracavernous internal carotid artery into the superior cavernous sinus compartment. And 3B would mean that the tumor is located below the intracavernous internal carotid artery into the inferior cavernous sinus compartment. The grade 4 implies that the intracavernous internal carotid artery is completely encased in the mass. One representative sign of pituitary mass is bitemporal hemianopsia. This occurs if the pituitary mass has expanded supracellularly, and it can also cause blockage in the flow of cerebrospinal fluid, causing hydrocephalus, and also increase the intracranial pressure, causing papilledema, which can be observed in the optic disc with blurred edges and the raised disc. The supracellular expansion of the pituitary mass presses on the optic chiasm. This means the optic fibers that have been innervating the nasal retina are affected. The nasal retina, because of the eye's spherical nature, are responsible for the temporal size of the visual field. So, when the optic chiasm is compromised, the temporal halves of the world would be blinded, as seen in the right bottom picture. This is called bitemporal hemianopsia. Also closely located is the hypothalamus. This structure is responsible for satiety, regulating temperature, and thirst. So these fundamental regulatory functions of the body may be impaired with the suprasellar expansion. With that, nearby cranial nerves can also be compromised, leading to ptosis and diplopia, as the cranial nerves 3, 4, and 6 are affected. This is especially the case if the mass also expands laterally. Other symptoms and signs include the forehead and cheek numbness, as the branches of the trigeminal nerve are affected. Inferior expansion may trigger postnasal drip, headache, nausea, vomiting, and seizures, as well as visual field defects can occur. If the pituitary secretion is affected, the hormonal secretion is lost in the order of growth hormone, luteinizing hormone, follicle stimulating hormone, thyroid stimulating hormone, ACTH, and prolactin. For ADH, cortisol, thyroxine, and LH-FSH, we have listed the symptoms that the patient may experience if these hormones are lacking. For patients with potential pituitary mass, do a complete ophthalmic history including visual field changes, do a thorough HPI, gaining information on everything that the patient has noticed to be abnormal about their bodily functions. Conduct and watch closely the extraocular movements, and look for signs of pituitary hyposecretion from thyroid to the reproductive system. To investigate for the pituitary mass, do a Humphrey visual field to see if the optic tract has been affected, image the head to locate the mass, and measure the hormones thoroughly to see if anything is missing. So estradiol and the free testosterone, IGF-1, or oral glucose suppression test to see if growth hormone is adequate. ACTH or cortisol, we can do a 24-hour urinary free cortisol, or 1 milligram dexamethasone suppression, or midnight salivary cortisol at around 11 p.m. For prolactin, we can measure the serum prolactin. The treatment of pituitary mass includes surgery if the patient presents with acromegaly, Cushing-Wood syndrome, or tumor that's 1 centimeter or greater and is progressive. Surgery's goal is to remove the mass. Then radiotherapy would be administered as adjunct. For medical therapy, the aim is to supplement the missing or insufficient hormones, either the gonadotropin releasing hormone that can be supplemented, oral cortisol, and the medical alert bracelet can be given for ACTH deficiency, Synthroid for TSH, testosterone intramuscular or per oral for males, and estrogen per oral for females for missing LH, DDAVP, which is a synthetic version of ADH, monitoring IGF-1 for the growth hormone. Dopamine agonists can be given for any prolactin producing tumors, and somatostatin analog dopamine agonist or growth hormone receptor antagonist can be given for acromegaly symptoms. Cortisol receptor antagonist can be given for Cushing's. So hopefully through this presentation we were able to demonstrate that the pituitary mass represents a good link between ophthalmology and endocrinology. here is a summary slide of everything we have talked about with regards to pituitary mass. And here is the reference from which we pulled the information. Thank you for watching this video.